So this is not intended to read everything. This is just to tell you. This represents most of the studies that have been done in sickle cell so far, and there are a few others that the switch trial, for example, has now stopped, and the twitch trial has started, and now we are going to be involved with that. So these are a whole host of trials, and the trials continue with hydroxyurea to define benefits and benefits to different things. So the first study, which was published in '84, was patients who were sickle cell patients, SS or S beta 0 thalassemia, were randomized, meaning at a pivotal point to receive the drug or to receive a sugar pill, basically a placebo. And the study was supposed to have gone for about 4 years, and what was being observed was whether patients would have less crisis on the drug and more if they were just getting a sugar pill. After about 18 months, the study was stopped because it was very clear that the patients who were on it were benefiting tremendously, and the patients who were not getting the drug continued to have crisis. So what they showed is that hydroxyurea reduced by about half the number of crises per year. It reduced acute chest, which can be quite severe with ICU admissions, etc., by about half. And in doing that, it reduced transfusions, because if you're not getting sick, you won't need transfusions. So coming out of this study, this was done in children over the age of 12. After that, it was opened up for not licensed for sickle cell disease, but the FDA approved the use of it, and Health Canada for use in sickle cell patients. So that was back in '84 when that was published, and those almost 300 patients have been followed over the last several years, and every so often we get an update on what's happening to that cohort of patients. So out of those patients, they've been able to track 233 of those 299 patients, and it is clear that taking hydroxyurea has been those patients who are on hydroxyurea have taken it for some period of time, have a 40% reduction in mortality or death over those years. So this is '84 to this was published in 2003. So over those 9 years, it appears that patients have a lower death rate on hydroxyurea. So then there was a subsequent follow-up study of those same 299 patients. It was published in 2010. And again, patients who had long-term hydroxyurea exposure, there was less mortality in that group of patients. And I highlighted one of the no teratogenic effects. So in some of those patients, they actually fathered or mothered children, and those babies, while on the drug, those babies have been fine in follow-up. Again, high fetal hemoglobin levels leads to lower death and illness. Please ask questions if you want as we go along. There have been other drugs, other test trials specifically in children, and this one, it was called the Hug Kids study. These were kids from 5 to 15 years, and they started at a reasonable dose, which we would start at now, 15 per kilo, and with increasing doses over time. And that what came out of that is that the drug is safe for children, and it says here when treated by a pediatric hematologist. The reason I put that in is that with the follow-up, the intense follow-up that happens and monitoring. Anybody could treat anybody, a patient with hydroxyurea, but you have to follow the patient. You have to get the blood work done, and you have to be obsessive about getting the blood work done and following the patients, because patients can run into trouble. That's why when we give prescriptions, we give 3-month supplies with no repeats, because we want to see you back in 3 months, so we pull you back in so we can review what's happened in the last 3 months, make sure we get counts and so on. Because if you have somebody out there giving repeats, then we won't see patients, because that's practical. If you can get your medicine and you're staying healthy, you keep getting it and you won't come down all the way downtown or wherever. This is a similar looking at the impact of height, weight, or pubertal development, no adverse event. What some of our parents, and some of you may recognize this, is when you start giving hydroxyurea, so one of the early things that parents tell us is that the appetite goes up in the children. They eat more and they get more energy, and they're eating them out of house and home. So that's what we hear from some of the patients. I don't know that the height and weight is better on hydroxyurea. Children with sickle cell disease will grow and develop normally. The puberty is a little bit delayed by about 2 years for boys and girls. So whereas girls go average puberty now is about 12.5 years, our girls would start having the menses at about 14, and the boys it's about 16 years when they give their growth spurt and catch up with their peers. So the tough years for the kids in school are grade 9 and 10, when they might be the shortest in the class. But you can reassure them they'll catch up and meet up with their peers. Joseph, am I right? Okay. Not everybody. Your dad's very troubled, so there's some genes that help you. Again, pretty much all of the studies have shown the same effect. Decreased crisis, fewer chest crisis, growth rates have been, this one said growth rates were better than expected, and the effects on the blood picture have been sustained. So, in terms of developing, we might have some questions. Anybody has questions about the studies that have been done? Any uncomfortable feelings? Anything? Bring it up, please.
Yeah, I have a question here. I don't know if I hear it somewhere or if I read it, that being on hydroxyurea, you're not able to have children?
So we have several, in the big study and in our own experience, we have several of our patients, boys and girls, men and women, who have had babies on the drug. Fertility in sickle cell disease is normal. On hydroxyurea, there have been some, not in women, but there have been some reports of a decreased sperm count in men. But the truth is, we don't know if hydroxyurea decreases the sperm count because we don't do a sperm count before. It's usually patients on hydroxyurea who get married and try to have children, and then they do, they investigate why that's not happening, and they found a low sperm count. So, and it's not common. So is it that the hydroxyurea reduced the sperm count, or is it that they were having low sperm count anyway? You see what I mean? We don't do sperm counts before and after, so there's no way of proving. There's no way of proving it. But if you're on hydroxyurea and you want to conceive, whether you're male or female, we recommend you go off hydroxyurea at least 3 months. Get it out of your system before you get pregnant, or have your wife get pregnant. Just we worry about any drug in pregnancy affecting the baby, the fetus. It doesn't matter, any drug. These hydroxyurea studies have not shown any abnormalities in the babies, but as a general rule, I mean, any of us, we tend not to want to drink anything or drink any medications if you're pregnant, as a general rule, if you don't have to.
Oh, okay. I just wanted to add, I don't know, I'm not sure if it's Dr. Porter or another doctor that mentioned that a good thing that could also happen is if you're a male, for instance, probably you could save the sperm. I don't know what you think about that.
Yeah, so you start producing sperm probably over the age of 15. In the past, I've tried to save sperm in 14-year-olds when I've managed kids with cancer before, and we didn't get too much of a result. So probably over 14, you start producing sperm. If you wanted to do that, you can do that. If you're a grown man and you're about to start hydroxyurea, you could. It would be fine to store sperm, just in the event, for the future. If you started already, then what you continue because its function is working well for you, and then when you are ready, if he's ready to have a baby, then stop for a while. You get to stop anyway because we want you to stop before having a baby, trying to conceive. So, yeah.
How long does one has to do the blood work? How long does it take for you to stop the blood work?
Every 2 weeks.
Every 2 weeks, yeah.
So we tend to be a little bit obsessive with children. And we say every 2 weeks, and you're probably doing it every 2 weeks forever.
I'm doing it, I think, once a month now.
Once a month. So if you, so we're relaxing a little more as me personally get more experience. So every 2 weeks for at least the first year, or until you get a steady dose. You're not changing dosages. Like when the kids finish growing and you stop increasing doses and they're on a steady state dose, then once a month at least.
And that will be continuous for once a month, or we have to stop for certain time?
We get to say once a month forever. Once you're on it.
So outside of the white blood cells dropping and the possible risk of infection, what other risks are there?
So, okay, let me move on and we talk about side effects.